Hi everybody, it's me, it's Dr. Kestler from Lorain County Community College. Welcome to today's COVID video. My temperature today is, and by the way, I'm sorry today, I'm a little late. I got very involved with some experiments yesterday, and I will tell you what they were about at the end, because it's going to be coming up in a future COVID video. First of all, let me tell you what my temperature is today. It's 96.5 degrees Fahrenheit. That's 35.8 degrees centigrade. I want to talk a little bit about what it is that we've been doing. We started this whole series. The first one I ever did was on flattening the curve. And I want to just impress upon you that that has been successful. That is a successful endeavor that we have all benefited from. First of all, let me show you that if you look at the daily cases in Ohio, you can see that we are right now flat. And I do expect that to continue at that rate for some time and possibly go up a little bit. But the whole goal of this has not been to keep people from getting infected, because that is going to happen as a consequence of time. The goal is to keep the hospitals open and keep the hospitals away from being at capacity, so that we could better serve people and we could prevent deaths. And I think we've done a tremendous job about that. And you can see on this slide here shows you that the hospitalizations are sort of flat. One of the things is I don't take much credibility in the where it's marked preliminary, and that is because there are delays in reporting everything. So you get into this situation where you don't take. So I see the hospitalizations as mostly have gone down a bit and are leveling off, which is good because now we can take care of all kinds of people and help them. Do I expect more cases coming? Yes, I most certainly do, especially with events that have happened in the last month and a half. I think we're going to see more and more. One of the things that you can, I think that a lot of people point to Sweden, and I think that the architect of the Sweden response, which was supposedly to try to rush and try to get as many people exposed as possible, I think the argument is that they realized that that strategy has not been all that successful. All right, I want to report about a new study, and this is especially something that's interesting to my students, and my students are very interested in genetics because that's kind of what we do. We look at genes that are involved in resistance to disease. That's kind of a thing that we have going, and this study is a preliminary study out this week about genetic preferences that SARS-CoV-2 or the COVID-19 virus has. And those genetic preferences are, one of them is I saw this very early in the Chinese data of back in February now, I think is when I first started noticing that they were seeing more cases in people with blood type A. And I don't know the exact molecular mechanism of how that works. We'll look at that later. I do notice something that my students will be very interested in is there's a whole cluster of genes not quite yet identified on chromosome number 3 that are involved with possible playing a role in SARS-CoV-2 infection. Chromosome number 3 is an important one for my students because that happens to be the location of one of the genes that we study, and that gene is involved with resistance to other diseases. The gene that we study is involved with resistance to Yersinia pestis disease, also known as the Black Plague, and is also involved with resistance to HIV. So we're anxiously awaiting to see how we can hone in on those genes and try to laser focus and see where they are. 23andMe has also been working in this regard to try to figure out what is going on there. I want to do a little bit about testing, and that is we desperately need antibody testing, and that is the thing that has been I've been talking a lot about. And one of the things that we need is not only a binary test, have you been, have you not been, that is good. We also need quantitative assays. And this little cartoon here shows you what quantitative assays kind of look like. You have, first of all, you have an ELISA test versus maybe an antibody yes/no test, and you can see positive versus negative, and that's great. And those are easy to run. You can run. It's exactly the same technology as you would run in a pregnancy test or a strep test. Same kind of thing as the yes/no test, and you get a control and a test, and you can see whether it's positive or negative, and that's good. But if you can quantify it by doing a dilution series and see where the positives are, you can actually assign protection versus non-protection. So we really need both. So I'd like to know, for instance, yes, I'm positive, but no, I'm not protected. My antibodies are not high enough to be protected. That's important, and I'd like to be able to know that, and that is something that we want to get at. Finally, a couple more things I want to talk about here is the COVID studies with respect to the hydroxyquinone were retracted. Those studies have been, a couple studies have been retracted. And I will tell you that, you know, when a paper is retracted in a journal, that is showing you how the system works. I mean, that is how science works. When a paper gets retracted, that is important. It is getting corrected. I was listening to something on the radio yesterday talking about fake news and fake posts in social media, and it is all of our jobs to, when we find out something, well, that wasn't real, to actually post a retraction, to say, hey, I posted something on my Facebook page or on my Twitter account and it wasn't right, and I want you all to know that I know it wasn't right, and I'm taking it back, because that's important, because otherwise that kind of thing keeps propagating. So when a paper gets retracted, that shows you that science is working, that we police ourselves. The whole goal of science is reproducibility, and when you can't show something, then then our goal is to search for the truth. And so a retracted paper is kind of good news there. I also want to caution people. A lot of people are protesting, and that is a good thing. It is a good thing that people are protesting. It's a good thing for people to be upset, but you need to do it safely. You need to do it with a mask. This picture here is from a group from, I want to give a quick shout out to my friends in Australia. Good day. They're not appropriately socially distancing. For those of you who are protesting, wear that mask. You can see, I would say, about, in this picture that I have shown here, I would guess about, maybe 40% of the people have masks on. That's the good news. The other story is they're on top of each other. You can actually show that you're a bigger crowd if you spread out. So whatever you're protesting, there were protests in the state houses in the last few months, or there's protests in the streets right now. Make sure you're distant, and just to tell you, you'll seem like you're a bigger crowd if you're more distant, and that is a good thing in there. And then just, remember to be good to each other. I want to just tell you why I didn't get a co-video out yesterday, because my students and I were working very hard on some experiments, and we ran out of time. And I will tell you that we are now working on, masks. Masks. Masks are great things. I'm going to put mine on right now. And they're great things. And yet there are differences in masks. I've got here several kinds of masks that you can wear. Some of them are more comfortable than others. Here's another mask. Here's one with that famous logo on it, N95, and here's my cloth mask, and the mask I'm wearing right now. I will tell you in a couple days I'll be sharing with you some data on masks because we've been playing around with them in the laboratory, and I will tell you there are masks and there are masks. Not all masks are created equal. I guess that's my big point here. Okay, I'm going to stop right there. Be good to each other. Stand up for each other and support each other and be upset with each other together and but be apart. Make sure you keep yourself distant and be safe. Be good to each other, and may you all persist like a lentivirus.